Hello everyone, welcome to my channel Physiotherapy Online Lectures for BPT and MPT. Today we are going to study Gait, one of the important topic we should study of exercise, one of the important topic of exercise therapy. Now firstly we will know the definition of the gait. The gait is normally we can know the gait is the pattern of walking is called in one word. We will say the pattern of walking is called as the gait. Mainly here the definition stands for, it is defined as the translatory progression of the body as a whole produced by the coordinated rotatory movement of the body segment. Okay, it is normal gait. It is rhythmic and characterized by alternating propulsive and retropulsive motion of the lower extremities. Next, the task involves in walking or gait. According to Rancho Los Amigos or RLA classification, there are three tasks: are weight acceptance, single limb support, and swing limb advance. Next, what is the gait initiation? It is a series of events occurs from the initiation of the body movement to beginning of the gait cycle. It is the gait initiation. It is stereotyped activity in both young and old healthy peoples. The normal duration of this phase is about 0.6 seconds. The gait initiation phase. Now we will study the kinematics of gait. In the kinematics of gait, there are two phases. One is stance phase, second one is swing phase. Okay. Now the stance phase. It begins at the instant that one extremity contact the ground. One extremity, any one of the extremity contact the ground. Extremity here, extremity mainly the lower extremity is defined as, it begins at the instant that one extremity contacts the ground and continues only as long as some portion of the foot is in contact with the ground. It is approximately 60% of the total gait duration. If the total gait duration is of 100%, the stance phase is of 60% and another the swing phase is of 40%. The swing phase, it begins as soon as the toe of one extremity, here the lower extremity defines, leaves the ground and ceases just before the heel strike of the next phase or contact of the same extremity. Okay, and it makes up to the 40% of the normal gait cycle. Next is double support. Lower limb of one side of the body is beginning its stance phase and opposite side is ending in the stance phase. That is known as the double support position. During double support, both the lower limb are in contact with the ground at the same time. It approximates 22% of the gait cycle. This phase is absent in running. Now we'll know the subdivision of the gait. In subdivision of the phases of the gait. Now subdivision in the stance phase and swing phase. Normally two subdivisions are there. The phases. The stance phase is further subdivided into 5 and swing phase is further subdivided into the 3. Stance phase is heel strike, foot flat, mid stance, heel up and toe up. And swing phase is of acceleration, mid swing and deceleration. Okay. Now we'll know this phase is classified into two types. One is traditional type, okay, and another one is RLA or Rancho Los Amigos type. The phases of the gait are divided into two types. Okay, phases. Okay, two classifications are there. One is traditional type classification, another is Rancho Los Amigos. Here in traditional type, it is known as the heel strike. The first phase here you can see, it is here heel strike. Okay, the first, but in the traditional phase it is heel strike, but in case of RLA it is known as the initial contact phase. Okay, same wise, next one is a foot flat. Here is the loading response phase. It is known as the mid stance. Here is also the mid stance stage. Next one is the heel off. Here is terminal stance stage. Toe off is the pre-swing stage. These are the stance phases. These five are the stance phase, and these three are the swing phase. And these same wise, these five are the stance phase, and these three are the swing phase. In case of traditional, it is known as heel strike, but in case of RLA, which is known as the initial contact, that is the difference. Same wise, in the swing phase, in traditional, that is known as the acceleration phase, but in case of RLA, it is known as the initial swing phase. Same wise, here it is mid swing, it is also known as the mid swing phase, and last phase is the deceleration. That is known as the terminal swing. Yeah, it is known as the deceleration. That is the terminal swing. Okay. Traditional phases. We will study here only the traditional phases, not the RLA phases. Okay. That in the traditional phases, first one is a stance phase. In sub-classifications of the stance phase, that is known as the heel strike. Heel strike begins with the initial contact. Here, see, initial contact of the heel ends with the foot flat. It begins with the initial contact of the foot or heel, ends with the foot flat. It is the beginning of the stance phase, and when the heel contacts the ground. Okay. Number two is the foot flat. Foot flat. Okay. Number two is the foot flat. Here, this you can see foot flat. It occurs immediately following the heel strike. It is the point at which the foot fully contacts the floor. Okay. Next one is the mid stance phase. Here, it is the point you have to know. It is the point at which the body passes directly over the supporting extremity. So this is the supporting extremity, and the body passes over. Here you can see the body passes over from the supporting extremity. This is the supporting extremity, and the body passes over from the supporting extremity. That is known as the mid stance phase. Okay. Next one is the heel off phase. Heel off phase is known as the, here see, heel off of the that extremity, right extremity. Okay. The heel is off. Okay. Here at the point following the mean stance at which the time of heel of the reference extremity leaves the ground. Okay. Next one is the toe off. The point here is the toe off. Okay. Here is the toe off. Okay. The point following heel off when only the toe of the reference extremity is in the contact with the ground. Okay. It is the traditional classification of the stance phase. Next, we study the swing phase. First is the acceleration phase. Acceleration, it begins once the toe leaves the ground. Once the toe leaves the ground and continues until the mid swing, or the point at which the swinging extremity is directly under the body. It is the swinging extremity which is under the body, that is known as the acceleration phase. Next, mid swing phase, which is it occurs approx when the extremity passes directly beneath the body or from end of the acceleration or to the beginning of the deceleration. Okay. Next one is the last phase is the deceleration phase. Deceleration, it occurs after the mid swing when the limb is decelerating in preparation for the next heel strike. Means next one you will again the heel strike will occur. That before the heel strike, that phase is known as the deceleration phase. Yeah, that subdivision of the stance phase you can see from here. Okay, foot flat, mid swing, heel off, twirl, heel strike. Okay, that subdivision of the swing phase. You have to draw these pictures in the exam. These pictures, you have to draw these. When the phases will come, you have to draw these pictures in the exam. So this is the acceleration, mid swing, and deceleration. It is the subdivision of the swing phase. Okay. Now subcomponent or you can say the comparison between the traditional classification and the RLA classification. Yeah? It is the traditional, it is the RLA. Heel strike, that is known as initial contact. Foot flat, that is known as the loading response. Mid stance, that is known as the mid stance. This is heel off, that is known as terminal stance. That is toe off, it is pre-swing. Okay. Component of the swing phase, same wise, traditional terminology and RSL terminology. Acceleration is known as the initial swing, mid swing is known as the mid swing, deceleration is known as the terminal swing. Okay. Now here is the RLA phases, same as RLA phases. Okay. Same as you can go through the traditional classification, that is heel strike, that is known as the initial contact. So either or you can in exam either the traditional classification comes or the RLA classification comes. So you have to write accordingly. Okay. The load response, we talk about 11% of the gate, that is mid stance phase, the 30% of the gate cycle. Some other the terminal stance which begins at the body directly, 30% of the gate cycle. Okay. So now we will go through the next here, that is the whole gate cycle in one picture. That it was acceptance or double support period, where is double the support, that is single left support period, again the double support period, and here the single support period. Okay, hold, this is the stance phase and this one is the swing phase. Next, variables of gate. There are two basic variables which provide a basic description of here. One is time or temporal variable, one is distance, second one is distance or distance variables. Okay. Next, affecting the variables, the time or temporal variable and the distance variable, and the factors affecting the variables are the age, gender, height, size and shape of the bony component, distribution of mass in the body, joint mobility, muscle strength, type of clothing and footwear, habit and psychological status. Next one is the variables, that is temporal or time variables and distance variable. Temporal time variables, under temporal variable the stance time come, single limb and double support time come, swing time, stride and step time, cadence and speed. But in the distance variable, stride length, where the length, step length and width and degree of toe out. In this cadence is the most important. Okay, cadence. Okay, and in this here stride length or step length comes in the exam. Frequently degree of toe out comes. Okay, but in case of temporal or time variable, the cadence is the most important, frequently asked in the question. Okay, now we will come to the first point, is stance time. In the temporal variable, stance time, it is the amount of time that elapses during the stance phase of one extremity in a gait cycle, only one extremity. Suppose the right extremity from heel strike to a heel off. That is the stance time. Okay, the single limb support, it is the amount of time that elapses during the period when one extremity is on supporting surface only in the gait cycle. The supporting surface only of the gait cycle. That is known as the single. Double support time, it is the amount of time spent with both feet on the ground during one gait cycle. The percentage of time spent increased, it is in the elderly. The percentage of time spent decreases as the speed of walking increases. Okay. Next one is the stride length. It is the linear distance from the heel strike. Yeah, heel strike. This is heel strike of one lower limb. One lower limb, that is the heel strike. This is the linear distance from the heel strike to the next heel strike of the same limb. That is known as the stride length. Suppose this is the right foot. Here is the heel strike, and this right foot heel strike. Next, it is the left foot. Here is the left heel strike. But this from the length from here to the next heel strike of the right foot only is known as the stride length. See, here is the heel strike of the right foot, and here is the heel strike of the right foot. Again, the length between this is known as the stride length. Okay. Next is step length. What is step length? Right and left foot. It is easier. Step length is the heel strike of the right foot here and heel strike of the left foot. The distance between the heel strike of the right foot to the distance of the left foot. But it is known as the step length, and the stride length is what? From here to here. Only the right foot. Right or left maybe, but right to left in one single, that is known as the step length. Stride duration, it refers to the amount of time taken to accompany one stride. That is known as the stride duration. One stride for a normal adult is approx of 1 second. Okay? Step duration is also, it refers to the amount of time spending during a single step. Measurement usually expressed as second per steps. Okay? When weakness or pain in the limb, step duration may decrease or increase. Any pain or any other weakness occurs in the limb, that is affect the step length or step duration specifically. Next one, the most important, is the cadence. It is the number of steps taken by a person per unit of time. The unit of time. It is measured at the number of steps and the second or per minute. Normally it is a per minute. Okay. It is the measured at the number of steps per minute. So what is the representation? Cadence is equal to number of steps by time or minute. Okay. It is known as the cadence. Walking velocity, it is a rate of linear forward motion of the body which can be measured in meters or centimeter per second, meter per minute or miles per hour. Okay. Speed of the gait, it is referred as a slow, free and fast speed. Free speed of the gait refers to a person normal walking speed. And slow or fast speed of the gait refers to the speed slower or faster than a person normal comfortable walking speed, designated in a various way. Step width. Okay, the step width or walking pace. It is the measure of linear distance. Step width, see, measure of linear distance between the midpoint of the heel. It is the midpoint. See, it is the midpoint of the heel. Midpoint of the heel of one foot and the same point on the other foot. Here it is the midpoint of the heel of the So distance between midpoint of the one hill, distance between midpoint of the another hill. So that is the known as the walking base. Okay. The degree of toe out. It is another important part. It represents the angle of foot formed by each foot line of progression intersecting the line intersecting the center of the hill at the second toe. The angle for man is about 7 degrees from the line of progression of each foot at free speed walking. The degree of toe out decreases as the speed of walking increases. Okay, here is the degree of toe out. That is the degree of toe out angle of the thumb. See, here it is the angle of the foot from each foot line progression and intersecting the center of the hill and the second toe. Center of the hill and second toe. Okay. So this is the ear and this is the second toe. The angle between it is known as the degree of toe. Okay. One cycle you can see all the step length, straight length, right gait cycle, left gait cycle. Okay. The path of COG, center of gravity. It is always midway between the hips and few centimeter above from the S2 vertebra. It frequently comes in the short note. Few centimeter in front of the S2 vertebra. Least energy consumption if the CG travels straight in the straight line. It is most important vertical deflection, least important or vertical deflection, lateral deflection. Okay. Next one is the important is the Saunders determinants of gait. The gait determinants are first described by the Saunders and co-workers. 6 optimization used to maximize or minimize the exertion of center of gravity in horizontal and vertical planes is known as the determinants of gait. Okay, there are 6 determinants of gait. The determinants represent the adjustment made by the pelvis, hip, knee, ankles, and that helps to keep movement of the body COG to a minimum by decreasing the vertical and lateral excursion of the body's center of mass. It was thought that energy expenditure would be less and get more efficient. The first determinant is the pelvic rotation. The forward pelvic rotation occurs of the pelvis in the horizontal plane is approx 8 degree in the swing face side. Yeah, it reduces the angle of feet flexion and extension. It enables a slight longer step length. So this is the first determinant of gait is the pelvic rotation. Next one is the pelvic tilting. 5 degree of pelvic tilting occurs in the swing side during the hip abduction. In standing, the dip is a positive Trendelenburg sign. This dip, a pelvic tilt occurs. It reduces the height of the apex of the curve during the center of gravity. Number 3 is the knee flexion in stance phase. The knee flexion occurs approximately 20 degree. Okay, it shortens the length of the leg in the middle of the stance phase. It reduces the height of the apex of the center of gravity. See here, 20 degree of hip flexion occurs. It shortens the leg in the middle of the stance phase. Middle of the stance phase here. It reduces the height of the apex of the center of gravity reduces. Okay. Next one is the ankle mechanism. It occurs in the heel contact. It lengthens the leg at the heel contact. It helps and smoothens the curve of the center of gravity. It reduces the lowering of center of gravity. Yeah, it lengthens the leg at the heel contact. The ankle mechanism here, heel contact. Here the heel is contact in the ground. It lengthens the leg at the heel contact. It helps in smoothen the curve. Okay. Next one is the foot mechanism that occurs in the length of leg of the toe off as ankle moves from dorsiflexion to plantar flexion. Here in this phase, the foot mechanism is one of the determinants which occurs that smoothens the curve of CG and reduces the lowering of CG. Last one is the lateral displacement of the body. It is the physiological valgus of the knee, reduce side to side movement of the center of mass in frontal plane. The normally narrow width of the walking pace minimizes the lateral displacement of the CT, reduces muscular energy consumption due to the reduced lateral acceleration and deceleration. Okay, it is the physiological knee valgus. Okay, in the next chapter or next video, we will study the abnormal gait. Okay, thank you, students.